Good afternoon. Welcome to the Training Initiative's monthly webinar. This month, our focus is on managing mental health and well-being in the workplace. And I'm joined by a panel of experts in the field. I'll introduce them and then I'll ask them to give themselves a little introduction. I'm going to start. We're joined by Svenja Keller, financial coach and life planner, Angie Robinson, psychological safety coach, Steve Wildman, digital lead for South Staffs College with a considerable focus on mental health and wellbeing for both staff and students, and Chris MacArthur, who's European mental health lead at Jacobs. I'm going to ask my panel to give you a brief introduction, and then we'll start the debate. So I'm going to start with you, Angie.
Hi, everybody. Thank you. So nice to be here with everybody today. As Ben said, I specialize in psychological safety and creating psychologically safe learning and working environments where individuals can come to their place of work, to their place of learning, being themselves, feeling comfortable being themselves, but also able to make mistakes, report errors, ask questions, curious questions without fear of reproach from superiors as well as their peers, and how do we exist safely and with our peers and co-workers.
Thank you. Svenja.
Yeah, hi everyone. Really nice to be here. I'm a financial coach and life planner, so I help people make their own decisions about money and life by giving them guidance, information, and coaching. For employers, I mainly provide financial well-being. So I help the employees feel in control of their finances, and that helps them stay focused on work. Quite often, financial matters link in with mental health. So I help people feel in control and therefore be more productive.
Thank you. Chris, could you give us your intro?
Well, firstly, Ben, thank you for the opportunity to be on the call with you all today. As part of my role, I help drive our mental health strategy, so I help enable and deliver on that as part of a global wellbeing strategy at Jacobs.
Excellent. And last but not least, Steve.
Hi, Ben. Thanks for the invite today, and thanks for being invited to the panel. I'm Steve Wildman, Head of Digital Learning at South Staffordshire College. My role is to support digital adoption at the college with staff and learners, and I'm really excited and passionate about innovative uses of digital technology such as augmented reality, virtual reality, the metaverse and AI, and how we can use these and leverage them to support mental health and support for not only just our staff, but also for our learners as well.
Excellent, and thank you all. Thank you for that, and thank you for joining us today. So, I mean, it's obviously the mental health well-being in the workplace is a hot topic at the moment, and something that is becoming higher on the agenda of employers and employees. Probably particularly from the experience we've had in recent years. The pandemic, lockdown, the changes that's brought to working, to expectations of work and the organisation of where we work. I know that there was a study done by Westfield Health last year that identified a significant increase in employees reporting stress-related burnouts. That had increased to 46%, an increase of about 10%. From a similar study pre-COVID, and I think maybe that's one area that employers and employees are concerned about, that kind of the impact of workload, the impact of or the need to establish a good work-life balance, and really I think that's what our conversation today is about. I'm really pleased to have you four experts in your fields here to kind of to thrash that out and discuss from your perspectives, really, what are the things that we as employers and individuals should be thinking about when we're thinking about managing ours and the mental health of others around us as well. So I'm going to start with a pretty broad question, which is, what are the challenges that are currently faced in the UK with our workforce with regard to well-being and positive mental health? And I wonder, Chris, I'd like to start with you. If maybe we could get from your perspective, from the perspective of Jacobs as an employer, your role as that European lead for mental health. What do you feel are the challenges that we have in the workforce of today?
I think you started to touch on it there, Ben. I think the landscape that we're all in, to me, I think it's only now that a lot of us are maybe starting to process what we've been through with the pandemic, and in that, I think we're still trying to get life-work balance right, and I'll stress life being first there, and that balance. I think it's a challenge now with hybrid. There's definitely some advantages to it, but then there's a whole other mix longer term. I think we're still figuring out, we're still finding our feet in that, and probably as well built onto that. In terms of access to healthcare, if we look at the NHS waiting lists, we've all seen the headlines. I think no way about it now. I think as employers, we must do more now. I think the need for employers to do more in the current landscape is critical.
And do you feel that you've seen within that, though, that the move to hybrid working, the strains there are on the healthcare on the health service that mean that perhaps people don't I find it harder to access support outside of work? Are you seeing those impacts within the workplace in Jacobs?
I suppose one of the things that we've seen that was in particular with folk with their children and families getting children access to mental health care became a key. It's always been a concern, but it's got worse, and I think some parents in really desperate places trying to get their kids access to mental health support that they desperately needed. And one of the things we did this year when it came up to our benefits with our private medical insurance was to include coverage for age 12 and up when it comes to having a psychiatric assessment route. And also we added a neurodiversity diagnosis route as well onto that. So certainly in those areas, but I think the waiting list, we've all seen the headlines, haven't we? I think it's over 7 million people. So there's definitely a need for us employers to do more, because we want people to be at the best as much as possible and to thrive, because that's not just good for people or the right thing to do, but it's also good business.
Yeah, of course, and I think that's something that I'd like us to be touching on later. That idea of there's obviously benefit in making sure that the people we work with are feeling supported. Their well-being is they know their well-being is a priority, but obviously for employers have got to see where the benefit of that is, don't they? They constantly need to look at the bottom line and need to identify where the positives come. But just going back to the point you made there about maybe individuals with families struggling with children or issues they may have with concerns about their children. I know, Angie, your focus as a psychological safety coach, you actually have a specific focus on adolescents and children within education. I mean, perhaps this is a good time to hear from you.
Well, I was so grateful that Chris mentioned families and the extensions of our families and our children, and you also especially mentioned neurodiversity, because, as you know, with what we all experienced with COVID, our work-life balance completely merged. And I find it so ironic that it's called work-life balance. It should be life-work balance. The life should come first and work should come second. And what we found and what we've observed working with young people and adolescents during the time of COVID and also after, I was lucky enough to extend my practice throughout COVID because we could work outdoors, is that, prior to that, a lot of work was at work and a lot of home stuff was at home, and the two merged, and they haven't really separated very much. So with the merger of, working online and having these type of forum, and it's even ironic that we're having this forum over a lunch period. You know what I mean? Even though it's for the benefit of each other and for ourselves, it's ironic that we're taking up lunchtime to learn about how we can take better care of ourselves, you know what I mean, when we should be actually switching off and having lunch. But so that's such an interesting thing. So the expectations, there were so many expectations already. There was so much conflict around our work-life or life-work balance already. And then all of a sudden it merged, and your home became your workplace. Your home became your school. And there was very little, and there is very little separation. And it's sort of, we've embraced this. Yes, we can get more out of everybody because we can work anywhere, anytime. So have the expectations, and the stresses have maintained. So it's figuring out ways to make it almost simpler and disengaging from it to improve our well-being, which is so significant. And when you look at neurodiversity, as Chris mentioned, in terms of working remotely, and I know one of the interest is remotely, it can be significantly more stressful to work online or to be accessible all the time for neurodiverse young people as well. And then you've got parents managing work and neurodiversity. I have a neurodiverse son who has ADHD, and him working online and me working online at the same time was incredibly stressful and difficult for both of us. So it's having an awareness of all of that and trying to figure out how to differentiate between what is now work, what is now play, and where the separation is, let alone the balance.
Yeah, of course. I mean that's interesting, that the idea of how you balance those. I'm often I have a lot of hybrid working, and I can often be at home working when my teenage son is back from school, and trying to manage that aspect of supporting him with perhaps his homework and preparation can be a challenge, which I'm sure many parents will see. You made that point about working to live, living to work. Where is the balance? I mean, I suppose, Svenja, that's a key aspect of the work you do when you're working with individuals and with the employees within businesses.
Yeah, especially when I work with individuals, we very often talk about boundaries. And as Angie said, those boundaries are a lot more difficult now that we work where we live. So you have to actually work really hard on setting boundaries intentionally and making an intention to kind of switch off and do it. It's not a natural boundary on your way home. You're not in the office, so it's more of a physical separation. A lot of us don't have that anymore, so it has to be more of a deliberate decision to do that. But also, I was reflecting on what Chris was saying about people worrying about their children. So other worries then flowing into the work productivity or the inability to be productive, and that is the same with finance as well. And we've seen the cost of living crisis, we've seen massive price increases, a lot of worry around that, and that can really impact the way people work and the way people can focus on work as well. And we are all hardworking, and if you work really hard but also have to struggle financially, there's a disconnect there. It almost feels unfair. So employers have in recent years taken more towards helping people with their finances and just feeling a little bit more in control on that front as well. The same example as with adding children and helping people with their mental health and diagnoses and navigating the health services for their wider family. It's the same principle with finances as well.
Yeah, thank you. And I suppose on the point of the breadth of influence there is both in work and out. I mean, Steve, for you at the college, your consideration is both for your staff group and for that student body as well. So I suppose that you're constantly thinking about those two aspects, even before you're even considering the outside influence for both of those areas as well.
I think you're right there, Ben. And what you were saying about this work-life balance and maintaining this healthy balance between work and personal life is becoming increasingly challenging, especially when we're delivering more sessions online. We've got meetings like this. More meetings are obviously allowed to be put in place because we're no longer traveling, which is great for the environment, but for people's mental health and, overall well-being, having that breathing space and driving from one place to another does allow you to calm down. If you felt the stress is becoming overall, your well-being is suffering because we're getting more and more meetings in. And I think it's a fallacy that education gets lots of downtime and holidays. Often our staff are working from 8:30 in the morning till 9 o'clock at night, teaching different classes, and then marking over the summer period. So we don't see that downtime as much as we'd like and what people think that education do. But this stress also, work-related stress is also education-related stress. We're seeing the same in our learners. Our students are coming in with stresses and anxieties that everyday mental challenges that they have. And this often is then cascaded over to the staff who have heavy workloads themselves, are having to listen to the student, issues and tight deadlines of getting assignments in and high expectations. This cascades from the students to the staff as well. So the staff in education are not just looking at their own mental resilience, they're looking at the mental resilience of the students as well. And thankfully, education, we're seeing the mental health stigma. We're starting to break this down. Students are coming forward and talking to us more about this, which is leading to our staff seeing that this is okay to talk about as well. And also we incorporate it into things like tutorial programs. So they didn't have 2, 3, 4, 5 years ago, the stigma of talking about mental health was so different, and we've broken down a lot of barriers. But what the rest of the panel have said is these barriers are changing now, and our work-life balance, we need to start looking at how we can support staff and learners, with this work-life balance, because they are now working or educating from home in those environments, and the stress doesn't go away.
Yeah, thank you, Steve. Yeah, I suppose that aspect. My background, I was a teacher for 20 years before coming across to work for the Training Initiative. So the education system is certainly something I know inside out, and I suppose that element you're talking about, for teachers to have to consider and understand their own mental health and be making sure that they are acting towards ensuring their own well-being, but also that as their students. There's a lot of similarities there with managers, particularly perhaps inexperienced managers within the commercial sector, within business. I know that in our apprenticeship programs, our leadership programs, something that we put a lot of focus in is that sort of understanding of mental health and the needs for your own, safeguarding your own space, your own well-being, and ensuring that you understand where the support might be needed for your staff. What are the ways then? I am asking to the panel as a whole, really. If we're agreeing where the challenges are, what really are the keys to addressing those challenges? And I suppose just where I'd really like to start as looking is that point that you made, Steve, about the stigma. The starting point of a conversation to try and address some issues that you may have in your workforce is probably creating a bigger problem initially, potentially, because you're opening up things that then you've got to try and figure how do you address that? How do you deal with that? So how do we address these challenges? Could I ask Chris to come in first, please?
Yeah, sure, Ben. I'll try and answer that enigma. I think it's many things, right? And we just need to keep at this and keep trying. I suppose looking at your point of focus being on a conversation, I think leadership shadow plays a huge part in that. So I think senior leadership leading the way on this and being vulnerable themselves in an organisation. Our CEO, when he came in, there was kind of a series of interviews to introduce him to people, and one of the things he said was he had struggled mightily with his mental health, and it had very sadly played a role in him losing his father. And he spoke about over many years he had learned that he was only human, and maybe through falling in his own face so many times, he realised that he had to talk, he had to get better at that. So I think, leadership shadow is key. I think creating the environment, and Angie will speak much better than me on this point about psychologically safe spaces, inclusive spaces, where people can bring their whole selves, where they can take that risk and see that it's safe. All these things, as well as I could keep on going, Ben, but I want to give a chance maybe to some of the other panel members to come in here as well.
Okay, great. So I think you're right that this is probably a good point to discuss that psychological safety. But just before I come on to Angie, I just wonder, Steve, you talked a bit about the kind of, you started those conversations early on, and you feel that stigma you already sort of through that at the college. Or through addressing. So what ways are you addressing these challenges?
I think the college has been really good at addressing this. They see it from the learner's perspective, and again, as I mentioned, in our training programs, we have a tutorial element where learners come in and they discuss things that are happening to them. There's topics on there, and mental health and resilience is one of those that forms a crucial part of a couple of weeks throughout the year. They have an hour discussing their mental resilience and how to support themselves. So hopefully when they are work ready, they have they can recap back to how they were delivered sessions on mental resilience at the college. What happened was, when we started looking at this, it was interesting because obviously the tutors and the staff have to deliver these sessions to the learners. So they were reading up on all the information they were having to cascade beforehand. So we started to see an increase in people saying, yeah, this is affecting me as well. But the college was really supportive about this. And our HR department have been great at establishing things like wellbeing programs based on staff feedback, prioritising their mental health. We've put in things like counselling services. Again, these counselling services were things like mentor positions for the students, which the staff can actually embrace as well. And my particular area, where we've been looking at it from a perspective of teaching and learning, we can see the pressures on new staff, on existing staff, and how can we support that? And one of the key things like we're doing today is talking about it. So we offered things like, lunchtime coffee, teas and catch-ups, where staff feel that safe space. They can bring over their bag of chips or their healthy eating options, all sit down and forget about work for that half an hour to an hour, relax, discuss what's on their mind over lunch and chill, and also to feel like they're not alone. We, as you said, Chris, there's other people, there's high senior positions who can walk into these spaces, sit down, and the teaching staff can talk about this to them, and it allows people to open up. This is really great for us because the staff feel supportive, but more importantly, it allows them then to repeat these conversations with the learners, so they're reaching a wider audience. At the moment, and this, is constantly encouraged in the tutorial program.
Yeah, fantastic, and I suppose that's the essence really of the work you do, Angie. Those kind of conversations and establishing that, as Steve said, a safe space, psychological safety. Am I right there?
Absolutely, and both what Steve and Chris said, that it's the bigger picture, it's a systemic issue. So you know, there's lots of research and studies done on psychological safety and what makes the most psychologically safe teams. And or not the most successful teams, sorry, not psychologically safety, the most successful teams. And that involves innovation, creativity, productivity, bottom line, etc. So how do we get, apart from emotional and psychological well-being, how do we get the most out of this team in terms of organizational? For Steve would be, how do we get the most out of learning, academic rigor, etc. And the underpinning factor based on the research is psychological safety, and it is systemic. So as Chris was saying, it starts with the leadership. You can't put a plaster on and say we're going to have a well-being retreat, or we're going to have an excursion that's going to be team. Those are great, but sort of they don't permeate the whole system. And when you have leaders like Chris mentioned who are willing to be vulnerable and say, I'm going through a stressful period at the moment. I mean, I shared with the panel when we came on this afternoon. Initially, I have a sick child in Spain on a school trip, and I'm waiting to hear from the school to call me to let me know how he is. I mean, that kind of information, you just never know what someone else is experiencing in their individual life. And we have to prioritize that. So it is systemic. So a leader being vulnerable and consistently modeling that kind of rhetoric, that kind of behavior, but authentically. We all know when people say the buzzwords and, have a growth mindset, or whatever the positive psychological term buzzword is. We know when people are being authentic, and when our leaders say to us, I'm really struggling with this idea, I'm really struggling with this concept, I'm really struggling to meet this deadline, I need help. Or when a leader admits a mistake and says, I messed this one up, what do you guys think? Then it models you're authentic, hopefully, and you're asking for that assistance and that support and advice, you're advice seeking. You're modeling that authentically, but also you're inviting them to do the same. So that hopefully they will do the same. And then there's a massive, really, really important to individualize. So we always say in psych safety, break golden rule number 1. And people always say golden rule is treat other people how you want to be treated. No, treat people how they need to be treated, how they want to be treated. We have to individualize. And it sounds, idealistic, but it's fundamental. So we all are so unique and different, and it takes time, and we don't have the time to sit down and strategize. But if we can subtly have an awareness just in our consciousness that people are unique and they're individuals. Some people don't like being put on the spot. They find it very overwhelming. They might have had education trauma from when they were at school, and they were constantly told they were introverts and they didn't speak up, and why are you not speaking up, and they must speak up more. And that trauma stayed with them. So they're sitting in the boardroom. They've got a great idea, or in one of Steve's classroom, they've got a great idea. But when they're called upon, their prefrontal cortex shuts down and they just can't speak. And then they feel frustrated. They feel humiliated. Most importantly of all, the idea doesn't get put forward. Could be a fantastic idea that could change the trajectory of the learning or the innovation or the project or whatever it is. But it could also be quite dangerous. A lot of the research in psych safety is around hospitals and mortality rates. And the teams that had the lowest mortality rates actually reported the most errors, because those teams felt safe enough to say, I've made a mistake. So we learn from that mistake. We share the mistake within the hierarchy of our existence, the doctors, the specialists versus the nurses, etc. I made a mistake. I've seen you've made a mistake as the specialist doctor. We need to stop that. And then less people died. And the opposite was, the teams, the medical teams that had the highest mortality actually had the lowest errors. So it seems counterintuitive, but it's because they didn't report the errors. So there was no learning going on. So I totally embrace what you're saying. It's a systemic situation, and learning and practicing these conversations around what you were both saying as well is recognizing and normalizing mental health. And I think the generation coming up under us now are at such a great advantage with that, because we are all talking about it. I mean, I'm in the schools all the time. I'm in tertiary education systems all the time, and it's okay to say I'm not okay. And for men to speak up more than before, and to seek help. Providing the vocabulary is so important to creating psychological safety. So it's okay to use these words: stresses, anxiety, poor sleep, all the things impacted by overwhelm in our work or learning situation. I'm not sleeping well because I'm anxious. I'm anxious because I'm not meeting my deadline. So then you deal with the emotions first, and then you start problem solving. But the goal is to really look at creating psychologically safe systems, and then it'll exponentially. And the beauty of it is it starts bubbling out towards our other lives as well. And when we get home and we start creating psychologically safe environments for our families and children as well, when we see these wonderful people like Chris and Steve model it for us in our learning and work environments, the benefit is exponential.
Fantastic. I think I'm just going to pause slightly for a second. We've had some really lovely comments and some questions in there. So to the audience, we're aware of your questions and we will be coming on to those shortly. But just before, something you just mentioned there, Angie, you're talking about the impacts of being able to establish an environment where people are starting to share. It just rings back to something for me, something you said at the beginning, Svenja, about financial issues are often things that people really find difficult to share and talk about. So in the work you do, does that lead towards an environment in a workplace that encourages that psychological safety, helping people to start discussing some of those perhaps economic worries that they've tried to push back? Maybe it's not even just about sharing with others. Maybe it's about considering themselves.
Yeah, it's such a good question, Ben, because I was thinking when Steve and Angie were talking, encouraging people to talk more about mental health. If you then add the layer of finances on top of that, that is even more of a taboo subject. So, and people find it really difficult. If you are in financial distress, it's a really isolating problem to have. Many people, especially with their fellow co-workers, with their employer, they will not disclose that. That's one. Mental health plus finance is one level up from mental health issues on their own, which are in terms of taboo subject. So actually psychological safety plays into that really well as well. So creating an environment where general financial topics can be discussed, general information and general just awareness raising can be offered. So webinars or even information people can access online, things like that. But it's general, so no amounts are discussed. No one has to comment or ask anything. Normally, I allow questions to be asked anonymously in those webinars as well, just to give that extra layer of confidentiality. And then we do offer one-to-one sessions as well. So the employers will pay for everyone to have a one-to-one. But actually, I always think it's not everyone takes these sessions up. It's the fact they are there is what creates that safety layer. So if I had any issues, I could go to someone, because with finance as well, there's something called the advice gap. So in the UK, many people don't access financial advice. There are different studies and different numbers, but one of the recent studies says only 11% of UK adults actually access financial advice. So and there's that extra comfort cushion that if I needed some help, I could go somewhere, even if it's just a little bit of guidance or a question I could ask. Not regulated financial advice, that is a bigger subject, but it's just someone to be able to go to, and I think that's really important for people. But when you think about how isolating it could be for someone to have an issue and to just really worry about money, that will impact their mental health. So financial distress very often causes mental health issues. So that just exacerbates the problem, because if you have financial issues, your mental health deteriorates, you deal less with your financial issues. It's a really dangerous downward spiral. Equally, people with mental health issues normally have less motivation to deal with their finances. So there's a two-way link. And it is really difficult to get out of that. So for employers that do offer help, it is a big positive. It makes people feel that they are looked after. It gives them this comfort cushion or the safety net if anything ever went wrong. But also it raises productivity. Someone who feels in control of their finances will be more productive and more focused on work. They won't be looking at other jobs to maybe get a higher salary somewhere else, and they won't be calling in sick because they're so worried it's impacted their mental health.
Yeah, I can see that, and I suppose, you know, the one thing that is echoing there to me is that idea that a problem shared is a problem halved. I think as soon as you're able to start having an ability to talk, and maybe that needs to start in a one-to-one situation in a more secure environment, but hopefully that does enable people to feel more confident in speaking about that to their colleagues, to their managers, and starting to share some of those things for whatever the causes of distress may be for them on that. Steve, I know you had a point you wanted to make on that.
Yeah, that's great. Yeah, I think one of the things that education does really well, and at the college especially, is addressing those things that Svenja was talking about the financial issues and pressures there. From the start of a learner journey, we ensure that in our induction processes, the learners are all aware about the financial benefits and the help that they can get, to support them. Our mentors are trained. A lot of students at the start of the term come to our mentors discussing about how to juggle their financial commitments. Some of them, have families they're supporting while trying to retrain, and the mentors are given the information on how they can seek this financial support. And one of the other good things that the college does as well, it puts in things like employee assistant programs. It announces it in key messages, regularly. An email goes out to staff saying that they can get this support. It can be discreet, or people can go, they know who to go to talk about this. And there are lots of other things like rewards to make staff and students feel more positive about themselves and their achievements. And those go to things like what we're having this week with our student award ceremonies at Lichfield Cathedral. We have Staff Wellbeing Days, where staff can all commute at the end of the academic year and celebrate their successes. And also we have things called Me Days. The college puts something called Me Days, where the staff, they realise that people want to spend their time with a family to get that work-life balance. So they put a Me Day in. We've had a couple of those this year, and one's coming up, where the staff don't feel that they have to come in. They can actually spend time with a family and their loved ones, recap that time that they've lost with them if they've had time pressures in the past, and encouraged to send photos in, which is shared in key messages the following week, of all the staff enjoying themselves.
Great. Yeah, and I know there's lots of great initiatives there, and I think hopefully, the employers watching this and individuals watching this can take some of those ideas and start to think about how those are. And there are plenty of opportunities to look for employers, for workplaces that are really pushing that the opportunities for a positive approach to these parts. And I suppose the idea of just enabling something nice, just like that, the idea of sharing the photos, sharing in each other's lives, opening conversations between all of us, should hopefully push some way to relieving burdens that we all are going to experience at some point or other in our lives anyway. I've just got a question that's come up, or or a comment really from DILF Energy Solutions, making a point that from their perspective, the individuals working in an engineering environment, particularly, maybe don't have the same level of support that you might find elsewhere. Do you think that, or does the panel have some experience with? Is it easier in an office environment to establish these sorts of processes to encourage that interaction? Is it easier in an office environment than it is in a more in an environment that maybe is more focused around the hands-on work, or where people aren't in each other's in an exact space all the time? If there's someone who feels they've got a point on that, Angie.
Sorry, I had to unmute myself. Yeah, there was an interesting study done on in the construction industry in the UK recently, and I think there were around 140 odd participants. So not a huge study, but a significant one. And they said that the work-life balance and mental health, I mean, it seems obvious, was the strongest indicator and most negatively associated with mental health problems for them. And it was significant in that the remote working situation, feeling disconnected. Also, I think engineering, the energy solutions person has said, engineering work men environment. And I know we don't want to generalize it, but very often construction, for instance, I'm not sure about this situation, is very male orientated, outdoors. So it seemed also that there was sort of the subculture of toxic masculinity in that environment. Again, I'm generalizing, and I'm not saying that that's the situation with this organization at all, but it's something to bear in mind, where there is a different barrier, sort of to talking and normalizing it. And the flexible work conditions played a role in the research that the construction workers, and I don't know, again, if in the engineering environments and being more being off, not within an office environment, impacts well-being and mental health more as well, because it might feel more disjointed and disconnected to a certain extent. So I think there are some benefits to that. There can be some benefits to the being flexible, etc. But sometimes I think there's also the feeling of disconnection associated with flexible working hours in those sort of environments. But definitely, it is on the radar of the researchers at the moment, that kind of well-being and emphasis, and it is definitely different to a different, and it's more, it's not more nuanced, but it is nuanced in terms of the needs of that sort of working demographic and finding the appropriate care, because you don't generally sit down and have boardroom type meetings where we can sit down and share what's going on personally, or if there's a struggle going on. One of the interesting things that, in terms of psychological safety and getting people to share vulnerability and authentically and openly and honestly, was having regular check-ins. So instead of having annual reviews, performance appraisals, things like that, you have frequent weekly check-ins. And as time-consuming as that appears to be, the benefit completely outweighed the time used. So, for instance, in situations in work environments like that, that could be a potential solution, is figuring out whether on-site or off-site, remote or in person, much more being rigorous about individual check-ins to check how people are doing in terms of work, but also then creating a safe space to talk about, what's going on for you in your own life situation connected to your work, of course. I don't know if that's helpful at all.
Yeah, of course it is. Yeah, definitely. And it makes me think, Chris, that and I know obviously Jacobs have got a range of working environments across the globe as well. So there will be different individuals working in different workspaces, perhaps throughout different times of the year. I mean, what is the impact you see, and how do you approach that?
Well, firstly, I'd say it definitely needs more emphasis, and it is a very different environment. I just think of the nature of work, the type of work. We just need to, I think, talk about suicide in construction before we have alarm bells going off that there's a huge problem there, and that far too many men are dying. And the really sad part of that is a lot of them are actually in contact with healthcare providers, before this happens. So there's something in that sector about men not talking enough, or if they are talking, not getting what they need to get them out of those situations or where they are in that headspace. So there definitely needs to be more work, more emphasis in that area. I suppose some of the things we've tried to do is around, free suicide prevention training for all staff. We've had resiliency calls where we had staff on and be vulnerable about the different small talk, even in offices and on site and spaces, has made to them stepping back from choices they might have made otherwise, and the fact that small talk amongst peers can make a really big difference. We've also created a free check-in tool that allows people to measure, see their mental health and start to form a plan. Interestingly, with that, we found men have engaged more with it, perhaps because the conversation starts with themselves on their phone rather than them having to go and talk to someone. They can kind of measure it, quantify it, and it'll help them get a plan or tell them if they need to talk to the doctor or a loved one. So, that's maybe a good sort of conversation starter and way of engaging them. But we definitely need to do more in this sector, because what we're doing isn't just working enough. You just need to look at suicide rates in that sector.
Thank you. Svenja, in the work you do, is there a difference in work environment, or even, you've just touched on gender there, and actually, male, female. Is there a difference to you that you see with the work you do?
Well, I don't see much of a difference in terms of with the financial well-being work that I do, although I tend to work more with professional services firms. And when I see this comment here, which I totally agree with, workmen or work people, that sounds self-employed to me as well. And obviously there is often not the safety net. So as a self-employed person, you might push and push and push because you can't, if you phone in sick or if you just don't work, there's no money coming in unless you have worked through a financial plan and protected yourself against that with insurances. But that's not always that easy. So there's probably more pressure on that if they are self-employed or contractors and not employed individuals. From a personal perspective, I am a listening volunteer for Samaritans. So we see everything that Angie and Chris have just said about the construction industry. Very interesting study, Angie and Chris. Certainly I've seen a lot of studies about the highest suicide rates being in construction is certainly one of the sectors, which is very sad, but it is often linked to the fact that it is more male dominated and it's less accepted to talk about mental health and issues like that. But as a volunteer, I also know how well it works to provide a safe space, which is anonymous for people to talk. So that certainly often works for people as a release. And that is then bringing it back to the work I do in finance. That is the case as well. And something that was said earlier, I just wanted to bring it up again because it works for finance as well. When people hear that other people have similar problems, for some reason, I said financial stress is often very isolating. So no one would say, I'm really stressed out with my finances. It's a huge stigma. But actually, when they hear that other people have similar questions and that other people might be struggling similarly with their heating bills or with buying food or whatever it is, it's actually a huge relief for them. It actually means it's not just me. I'm not on my own. So it actually, that works really well in the financial sense as well.
Great, thank you. I'm going to move on now to our next question, which is from Amber M, and that is about implementing wellbeing strategies. The question is, what wellbeing strategies and practices do you recommend for employers, HR professionals, that can be implemented, particularly for a workforce that has a mixture of office-based and remote working, and how can you ensure both are receiving similar support and time to bridge that gap? Would anyone like to lead on that? Chris, I'm going to go to you. Great.
Happy to maybe start and let folk build on this. I think firstly, start with asking yourself why you're creating that strategy, what it is that you're trying to achieve from it. And then I would say you need to be specific about the objectives in that, obviously smart objectives. Look at time, budget, I suppose. From a governance point of view, who's going to be the owner of that strategy, who's going to drive it? Do people have clear roles in that strategy and responsibilities? Do you have a senior executive sponsor that's part of that? And then you're, I suppose, moving on from the who to what you're doing and how, in terms of areas like prevention, promotion, support, identification, treatment, recovery, and then I suppose how through the policies, data, external benchmarking, and so on and so forth. But I would start with the why. And really asking yourself what it is you're looking to achieve or do with it.
Yeah, and I suppose the whatever the decision is to come to that hybrid working, it's certainly it's got to be beneficial for the business, hasn't it? But there has to be some buy-in from the staff as well. You've got to feel comfortable in your workspace, in your work environment, and feel supported. And I guess the hybrid model does lead to people being potentially feeling more isolated, potentially feeling less in the loop, and perhaps for businesses looking to establish that psychological safety, Angie, that can be a difficulty that needs to be overcome.
Yeah, I mean, I totally agree with everything you said, Chris. I think that it's fundamental to us start with the why, and why are we doing this, and what for. In terms of a hybrid and remote working, it's setting the stage, which is what you were talking about, Chris. Be open about the challenge. It's not easy. It's not difficult. I mean, it's not easy. It's going to be difficult. It's going to be challenging for different reasons for different people. It's essential to make sure that everybody knows what is expected of them, clear expectations, and also do they know what to do, and do they know how to do it? So do they have enough resources? Do they have enough support if they get stuck in terms of being remote and not having access in-house, etc. Things like focusing on outcomes versus output. Okay, so it's not just how much work you're generating, so how busy you are at home, or how many hours you've logged on, and how many hours you're in the office. It's what are we achieving? What are our outcomes? What do we want to achieve? And you sort of focus the work as a learning opportunity, and that sort of shifts and gets everybody working collaboratively. And then definitely collaboration. This is building a culture of appreciation, inclusion, and collaboration. And when it's a hybrid situation, if you have that inclusion, appreciation, and this culture, and you have rituals and routines that reinforce that appreciation, that culture builds, and it feels more inclusive. So it's sometimes more time consuming to create rituals and routines, but you can draw everybody in at the same time. I know an organization I work with here in Guernsey, they have a once a month they have, and again, it sounds like something quite simplistic, but they have a cake day, and they can all order a cake. There's an amazing bakery here in Guernsey, and you can order your cake, and if you don't want your cake, you get your cake, some money gets donated to charity, but also people working remotely get their cake as well. I mean, it's a very small place, so we can have these things delivered and shared equally on an e-bike. So we are environmentally friendly. But, you know, sort of those rituals, and it goes without saying that that is what happens on that particular day. That promotion of those rituals and routines. But it's also equally important. Psychological safety is not always feeling comfortable and cozy and happy and, you know, sort of lovey-dovey with each other. It's how do we set boundaries with each other? I think Svenja spoke beautifully about setting boundaries, but how do we establish work boundaries when we are working remotely and when we are working, you know, if there's a hybrid situation? So we are accountable to each other. We are accountable for our work. We're accountable for our values, for maintaining rituals and routines and the outcomes. And if there's very clear set boundaries, then you can have tough conversations in a safe, respectable way. That's very important. And then, of course, you know, put your own oxygen mask on first. So you look after yourself, and if you look after yourself, you can look after other people. And it's again seems simplistic, but looking after our own well-being when we are working remotely, like Svenja said, setting, you know, deadlines as to when I'm stepping into my work office and out of my work office, differentiating, and you know, things like accessibility. When am I accessible? When am I not accessible? That kind of thing can promote a psychologically safe environment. So you can actually push back when someone's asking too much of you. You can push back as well and say, no, this is not working for me. This is the result of the stress created by it, whatever. So you're not afraid. You're not afraid to say the negative things. You're comfortable saying the good things, but you're also not afraid to challenge and even challenge your superiors in a respectful, kind manner.
Yeah, that point you make about understanding your own limitations, your own mental health, your own well-being, and being able to address that being key. I mean, that takes me back to what you were saying, Steve, about in the college that a lot of the pieces of support that you put in place, those processes actually enable your staff to then support the students. I know that Steve and Svenja, you'll have things to add to this, but I actually want to move on to a question that we've had from Andrew Tilley, which I think is kind of linked to this. So I'm not leaving Ambers completely, but just while we're talking, if we could maybe just have a look at this, you know, how do you go about creating a workplace culture that protects and promotes mental health and well-being in the face of potential antipathy or opposition towards that from staff or managers? So if you're looking to implement things and staff's response is not really to buying into that, what's an approach? How do you approach that? How do you counter that? I wonder whether you might have anything that you'd like to add to that, Svenja.
Yeah, what I was going to say about the previous question very well works here as well. I think often we make assumptions what people want. So asking employees what they actually want and what's important to them might be a good way of finding out, and maybe reducing the antipathy or the opposition to some extent. And that can include managers and staff. Obviously, with staff surveys, there are sometimes problems as well. You don't always get the engagement. And obviously, people sometimes ask for the world. That's difficult to provide. But it is, if it's well managed and a well worded staff survey, I think it can actually give some great insight into what employees actually want and what's important to them and what they don't want and what's maybe not so important to them or what would cause opposition. So but also obviously you will never please everyone, but at least to have some understanding of what the majority finds helpful, I think is really important. And the other thing for me is to communicate. So if there's someone who's really opposing, giving them that time and say, tell me, what is it that you don't like about this? Or, you know, what's your suggestion? And really drawing them into the process and understanding where that opposition is coming from. So communication and not making assumptions, those are the two things for me.
Okay, great. I'm just aware we're coming to the end of our allotted time here. So just a reminder to the audience that everything is recorded and will be accessible through the Training Initiative website or our YouTube page. I'm just, as long as the panel are happy, just for a final couple of points here. I just wonder, Steve, if you'd maybe give me your response to that question.
I think the one thing that was talked about earlier is we're good in education of bringing in guest speakers and changing that culture of, you know, the stigmas about mental health. Now, we've all met on LinkedIn before. We're all friended. We've talked about this. This is a great place where, you know, people can talk about their feelings, their emotions, their emotional well-being. And again, colleges, especially this college thrives on bringing in guest speakers to talk about the issues. This normalizes the issues a bit more, so people feel more like they can open up. And I think that's one thing we could learn from this, that having guest speakers in to discuss things. It may not be your staff members that want to open up to begin with, but having guest speakers from other recognised business and partnerships that come in and talk about their mental issues that are faced will allow staff to come forward and start feeling that it's not just them, but, you know, people in high-powered positions do feel these issues themselves. And then it's not a stigma, it's not a weakness, it becomes a strength. And, you know, the word gets passed on and people can learn from this, from other people's experiences. And I'll let somebody else talk now. So.
Yeah, great. And I suppose really, you know, that maybe one of the answers to this question is it in the train of the conversation we've been having, but was mentioned very early on, that in order to build a culture that is supportive and encourages the workforce to be supportive, this has to be a constant. There has to be continual discussion, and that will grow. Plant the seeds early on, help people to feel able to discuss things, to bring things to the table with each other, with their peers, with their managers. If you can create that confidence across the staff as a whole, then hopefully that antipathy, any opposition that you may be facing, will dissipate as people begin to be able to discuss those points with each other and with their management as well. I think really, you know, we've overrun. Thank you so much for joining me today and taking this time. I would like, just before we leave panel, if you were able to give one piece of advice, you know, one recommendation to our audience, can I ask you what that would be? And I'll just go around as a sign off. We'll go in the way that we introduced ourselves. So I'm going to start with you, Angie. What's one thing you'd recommend to the audience to if they're looking for a way of making sure they are effectively managing mental health and well-being within the workplace?
Just stay curious and be curious to what other people around you are experiencing, because we're all unique. And at the end of the day, we all have very similar needs, fears, stress, and anxieties. And so if we stay curious as to what's happening within other people, we'll be a little bit more self-aware as well about what's happening within ourselves internally.
Superb. Thank you. And Svenja?
For me, it's don't make assumptions. So rather speak to people and find out, and don't judge, because we all have different situations, and it's in our brains to judge, but it's much easier if we don't assume and don't judge.
Great. Chris?
I think it would be to benchmark and hold yourself to account externally in some way. You know, so the Mind Index, for instance, asks staff directly how you really are doing, confidentially through them, and then they tell you in a report, and also look at your policies rather than your own internal surveys. So I think, benchmarking third party, I think that's always a good comparison and information.
Great. And Steve?
Yeah, I think communication, reach out to people like yourself, Ben, to people on the panel. If they feel that the culture in the organisation they're currently at is a bit staid, reach out to people like ourselves who are willing to support and to give any support and guidance, and see that barrier break down. Bring in externals who aren't afraid at the moment to explain how their businesses have moved forward and encourage mental health and resilience. Yeah, that's it.
Brilliant. Thank you, and yeah, thank you once again to the panel. So just to sort of tie it off, the message that I think has been pretty clear across the conversation this afternoon. One real key aspect for successfully managing mental health and well-being in the workplace is establishing clear lines of communication. And just to follow up what was said, so stay curious, make sure that you're talking with staff and you're encouraging those conversations to be continuous. Don't make assumptions. Make sure that communication is clear and you're listening to what is coming back. When you're looking to implement things, benchmark and hold yourself accountable. Make sure that you're looking at what's needed and how are you measuring that. And I suppose going back to what we talked about earlier, that kind of leading by example is key to that. If you're expecting for the staff as a whole to be discussing things and taking part in the activities or the processes that you're putting in place, you've got to make sure that as managers you're doing that yourself. And as you say, Steve, the more of those voices that are involved, whether that is from new recruits up to managers or individuals you're bringing into the business to keep that conversation going, the more voices, the more diversity in opinion and points of view, the better that conversation, the richer that conversation will become, and the more opportunities you'll have for supporting individuals and the group as a whole to support their well-being. There are two last comments in a thing now. I will we'll look to come onto them, and we will answer those another point. Thank you once again to my esteemed panel: Angie Robinson, Svenja Keller, Chris MacArthur, Steve Wildman. I'm Ben Calvert-Lyons. This has been Managing Mental Health and Wellbeing in the Workplace from the Training Initiative. Next month, we'll be looking at focusing on supporting your brand to develop. Our date for that will be out soon. But thank you very much. I look forward to another enlightening conversation with you all very soon. Take care. Bye.